Now, I want to spend a few minutes just reminding us about some of the subjects of health I started 2 weeks ago. We are in the midst of a global pandemic. We all know this with the COVID virus. The hope of a vaccine is probably not going to be present for another year, I would think, and that is being very optimistic. Even if they can get a vaccine by the end of the year, which is the earliest that most of the vaccine people are discussing, the chance of getting a vaccine into clinical use would be at least another 12 months. So I think we ought to get used to what we're doing now, because this is not going to go away in the short term at all. The other thing is, just like what we're seeing now, there will be intermittent outbreaks of clusters of the COVID disease. And so what we are seeing now, we will continue to see the need for precaution. I don't think church will come back to its normal state for another maybe 18 months, I would think. And that's provided we get a vaccine that works. There is no sure hope of that. Let's keep praying that God will work things out for us. So how do we protect ourselves in this COVID season? Well, we said that you have to make sure that everything that God has given the body to heal itself is working at peak performance. Now, there are 7 body healers. God has provided healing in the physiology of the frame of our bodies, and you want to work with each of those in order to get that working at its peak performance. Now, the ones we spoke of last time was the skin. Everybody remember the skin? Keeping the skin. The skin is the largest organ of the body. It's not the liver, it's not the brain, it's not the heart, it's the skin. And the skin, therefore, ought to be maintained in good health. And we mentioned making sure that you don't put excessive toxins or poisons on the skin. We mentioned the need for sunlight and vitamin D. It has been shown that a low vitamin D level is a risk factor for succumbing to the COVID-19 disease. So getting your vitamin D levels checked as you're getting older is a good plan. Go to your doctor and ask them to get your vitamin D levels checked, but making sure that we have adequate sunlight, but not overly done, would be an important part of protecting ourselves and our immune system. The second one we spoke of briefly last time was the gut. Everybody remembers the gut? The need to have the proper gut health. We spoke about the need for rapid, adequate transit times. Transit times deal with your bowel motions. And we made the point that your bowel motion should be how many times? How many times you should go to the toilet? As often as you eat is the answer. If you eat 10 times a day, in theory, you're supposed to be going to the toilet 10 times a day. But the general advice is at least once a day. But the correct physiological answer is every time you eat, because whenever you eat, it stimulates the gastrocolic reflex. Gastro means stomach, colic is colon. And so you should normally end up going to the toilet every time you eat. The reason that we don't do that is I suppose 3 reasons. Number one is that the same way we have to train our bowels, you know, as a child you train you train them potty teaching, and you train your bowels. We end up training our bowels not to work. The same way we train our bowels to work as a child is the same way we train our bowels not to work as an adult. That's what I was trying to say. So that when we eat, whenever we get the gastrocolic reflex over the years, we suppress it. So say, for example, you get up in the morning and before you go to work, you have a meal, say at 7 o'clock, but of course you've got to get to work by 7:30. So what do you do after you have your meal? What's the next thing you're going to do? Get into the car to be on your way to work. In the middle of the traffic jam, gastrocolic reflex. So what do? Squeeze it in. You get the point? That's what we do. Hold it in. So the gastrocolic reflex dies away. Don't get it. So eat lunch. at 12 o'clock, but you have to get back to work by 12:30, gastrocolic reflex while you're in the job, while you're operating, in my case. Hold it in. Third time you get home, you might have one bowel motion. Now, you do that long enough, the bowel says, if that's how you play the game with me, that's how I play the game with you. So after a while, the reflex stops firing. And then you end up needing what? Laxatives. And then once you start using laxatives, your body becomes used to laxatives, and it is dependent on laxatives for a bowel motion. Does that make sense now? Because anything you do for the bowel, anything you do for the body says thank you. Because it's an effort to stimulate all these organs of peristalsis. So if you take that away by using laxatives, as some of us have to do, the body stops firing, and therefore you're completely dependent on laxatives. So that's one of the things we said, restoring proper bowel motion and activity. The other one we spoke about was the need for fiber, because fiber is what bulks the stool. So your normal bowel motion is based on peristalsis, it's based on squeeze relax action. It's called peristalsis. So the bowel squeezes, and the bolus comes down and it relaxes. And it squeezes, it goes down and relaxes. So it's this peristalsis. But you can't get peristalsis unless you have a bulky stool. Does that make sense? Unless the stool is bulky, it's based on what's called a stretch. It's like a rubber band. You have to stretch the bowel for it to collapse. You have to stretch it to collapse. So that's how as it stretches, it squeezes, stretch, squeeze. So that's the peristaltic action. So you must have fiber in your diet in order to stimulate bowel motion. And you don't get fiber from juices. You don't get fibers from chocolate. You don't get fiber from candies. You don't get fiber from lollipops unless you eat the stick. You'll get fiber from fruits and vegetables. Does that make sense to everybody? You don't get fiber from bread. By the way, you don't get fiber from bread, except it's whole wheat. But that bread that you buy in the supermarket is concrete. You all know that, right? That's concrete. It's white flour with chemicals mixed with water. It's concrete. So all you do is you concrete up the bowel and you lose the bulk. So you must create bulk by fiber, the soft fibers and hard fibers and so on, and you use the fibers to bulk the stool so you get a good bowel motion. The third one, which I mentioned, but somebody asked me about it last time, and I needed to say, is protecting the mucilaginous layer of the bowel, the mucin. So the bowel has a mucilaginous layer, that mucin or mucus that protects the bowel. Now that mucilaginous layer comes from the bacteria. Does that make sense, everybody? So within the villi, these little finger-like processes in the bowel, in the crypts, it's called the crypts of Liverpool, but in these little crypts lie the bacteria. And the bacteria are what produce the mucin, the mucus that lines and protects the gut. So what has been found, what's observed, is that in disease, you lose the mucilaginous layer. So anybody who has got ulcerative colitis or Crohn's disease or irritable bowel syndrome, you lose the mucilaginous layer and you slough it out. So in Crohn's disease, ulcerative colitis or inflammatory bowel diseases, one of the major criteria, the major symptoms we look for is what? Mucus in your stool. Isn't that right? You see mucus in your stool because you're sloughing it out, and therefore you're losing those wonderful villus foot processes that absorb and protect the gut. So what you have to learn to do is to protect the mucinous layer. As you get older, your mucinous layer gets thinner and thinner. So if you look at centenarians, you look at the centenarian study, which are the studies that the people who live to be over 100. When they do the biopsies of their bowel, they have very thick mucinous layers. Their mucin, that thick layer, is almost as thick as in a child. So it seems that there's a direct relationship between the thickness of the mucinous layer in the bowel and health. We also know that the bowel is the largest source of lymphatics in the body. It's not the spleen, it's not the bone marrow. It turns out to be under the bowel. So under the layers of the bowel, there's a large lymphatic and immune system that is there. It is the largest immune system of the body. So when you lose the layer, all of those toxins and bacteria and fungi are directly in contact with the immune layer of the bowel, and that's why you get an autoimmune reaction. Does that make sense to everybody? So it turns out that chronic inflammatory disease is the cause of practically every disease. Diabetes has now been linked to the gut health. High blood pressure has been linked to gut health. Cancer has been linked to gut health. If your gut is dysfunctional, it leads to inflammatory diseases, low level, that is associated with all of these diseases. So you have to protect your gut health. And so I want to recommend two things. Well, we mentioned three things. One I mentioned already, having good bowel motion. So if your bowel motion is slow, you build up toxins in your bowel, and toxins kill the bacteria, or they allow the overgrowth of what we call unfriendly bacteria. So getting proper transit time, rapid transit time, protects the gut bacteria. But the two other things I would recommend is, number one, using your culture of friendly bacteria, what we call probiotics and prebiotics. Have you ever heard of that term? So a prebiotic is the substrate that a probiotic works on. The bacteria needs to eat something, and they eat these undigestible sugars called prebiotics. But the real action is the probiotic, these so-called friendly bacteria. So I take a probiotic every day, like every day. You want to use a bacterial culture growth that is got multiple strains in it, not just lactobacillus or bifida. You want something that has multiple strains in it, and you want a large quantity. I think it's 62 million or 82 million I get from Dan's Pharmacy. And I use a large culture in my bacterial gut. But there is one other thing that we now know, and I'll close with this last one, that the mucin of the mucus layer of the gut is greatest promoted by a bacteria called Akkermansia. So Akkermansia mucilaginous is the name of the bacteria that promotes the largest, thickest layer of mucin in the gut. It's called Akkermansia mucilaginous. So you want to put the environment, make the environment as friendly as possible for Akkermansia to grow. Does that make sense? Because that's the bacteria, of all the bacteria we eat or have, that's the one that protects the mucilaginous layers. There are two things that you need to know, therefore, where you want to protect Akkermansia, which is the bacteria that promotes the greatest growth of mucin in your layer. You want to avoid anything that has a high lectin content. Lectin, any food that has a high lectin content. A lectin content is found in most plants and most beans and peas. Like a bean, like red bean, green beans, and all of those beans, that has a high lectin content. So for foods that are high lectin contents like beans, green beans, string beans, red beans, black-eyed peas, you name it, they're high lectin content, you have to make sure you cook them. Does that make sense? So there are some things you can eat raw, and there are some things you have to cook. And you have to cook your beans. You have to cook your beans. For your beans in particular, you either eat them sprouted or you have to soak the beans. My wife does this very well. She does that. I saw her doing it and thought, this is taking so long. But there is wisdom in what people do. Because I saw the old people used to do that all the time. They would soak the beans in the night. Did you notice that? You soak the beans in the night, you throw the water away, and then you cook the beans in the morning. That actually is the right way to protect yourself against lectin, because lectin is in the bean, the content of the bean. When you soak the bean, you take a lot of the lectins out, and then when you cook the bean, you destroy most of the lectins in the bean. And by doing that, you're able to protect the gut. So there are some foods you have to eat raw, like your fruits and so on. There are some foods you have to cook. And that certainly will be your beans and your peas. You have to cook them in the right way. And the second way that you do it is there is a supplement, an Indian herb, that has been shown to promote Akkermansia growth. It's called ashwagandha. Anybody ever heard of that one? It's called ashwagandha. So ashwagandha is an Indian herb that has been shown to promote the growth of Akkermansia mucilaginous. So those are the two things. You protect yourself by making sure you get rid of the lectins, or reduce the lectins by cooking, and you can use a herbal supplement, an Indian supplement called ashwagandha that promotes Akkermansia and good gut health. Well, that in mind, ladies and gentlemen, that's 12 minutes of talking of health, and that's probably enough for today. But I certainly will keep the conversation going. There's lots we still have. I've only gone into 2 of the 7 things that you need to protect yourself against disease in this COVID season. And we certainly will be covering all of those over the next few weeks. I encourage you to come back.